You have all said that you will repeal President Obama's health care legislation. Down the line, 30 seconds. If you repeal Obamacare, what's the answer?
We need to get the government out of the business, and we do need to have the right to opt out of Obamacare, but we ought to have the right to opt out of everything. And the answer to it is turn it back over to the patient and the doctor relationship with medical savings accounts. So I would say that we've had too much government. I've been in medicine. It's gone downhill. Quality has gone down. Prices have skyrocketed because of the inflation. So you need to get a market force in there, but medical savings account.
Healthcare in 30 seconds is a little tough, but let me try. Number one, you return to the states the responsibility for caring for their own uninsured, and you send the Medicaid money back to the states so they can craft their own programs. That's number one. Number two, you let individuals purchase their own insurance, not just getting it through their company, but buy it on their own if they want to, and no longer discriminate against individuals who want to buy their insurance. Number three, you do exactly what Ron Paul said. I don't always say that, but I'm going to say it right now. And that is, you have to get health care to start working more like a market. And for that to happen, people have to have a stake in what the cost and the quality as well is of their health care. And so a health savings account or something called co-insurance, that's a way to help make that happen. And finally, our malpractice system in this country is nuts. We got to take that over and make sure we don't burden our system with that.
Mr. Speaker.
Well, I just want to point out my colleagues have done a terrific job of answering an absurd question. To say in 30 seconds...
You have said you want to repeal Obamacare, correct?
Let me just finish, if I may.
30 seconds.
To say in 30 seconds what you would do with 18% of the economy, life and death for the American people, a topic I've worked on since 1974, about which I wrote a book called Saving Lives and Saving Money in 2002, and for which I founded the Center for Health Transformation, is the perfect case of why I'm going to challenge the president to 7 Lincoln Douglas-style 3-hour debates with a timekeeper and no moderator, at least 2 of which ought to be on health care, so you could have a serious discussion over a several-hour period that affects the lives of every person in this country.
Governor Perry.
Obviously, on the Medicare side, you have to have an insurance type of a program where people have options, of which give them a menu of options of which they can choose from. I think you have to have the doctors and the hospitals and the other health care providers being given incentives on health care rather than sick care. And then on Medicaid, it's really pretty simple. Just like John and Mitt both know, you send it back to the states and let the states figure out how to make Medicaid work, because I'll guarantee you we will do it safely, we will do it appropriately, and we will save a ton of money.
Mr. Kaine.
The legislation has already been written. H.R. 3000. In the previous Congress, it was H.R. 3400. And what that does, it's already been written. We didn't hear about it in the previous Congress because Princess Nancy sent it to committee and it stayed there. It never came out.
The main problem with health care in the United States today is the issue of cost. It's just too expensive. And President Obama said that's what he would solve in Obamacare. We'd all save $2,500 a year in our premiums. Well, we have Obamacare, but we didn't have the savings. So what I would do to replace it is to allow every American to buy any health insurance policy they want anywhere in the United States without any federal minimum mandate.
You can sit down with the 50 governors and you can address cost containment. This is a $3 trillion industry, half of which any expert will tell you is totally nonsense and superfluous spending. Number two, we need to do a better job in harmonizing medical records so that we can pull up on a consistent basis the most efficacious course of treatment for patients. And third, we need to close the gap on the uninsured without a costly mandate, letting the free market work and bringing people together with truly affordable insurance.
Back in 1992, I introduced the first health savings account bill that everybody up here said was the basis for consumer-driven health care. Secondly, I was someone who proposed a block grant for Medicaid way back in 1998 with Phil Gramm. Again, leading on this issue. I was always for having the government out of the health care business and for a bottom-up consumer-driven health care, which is different than Governor Romney and some of the other people on this panel.